Yeah. So after a long time, I'm going to start the sessions again. So share is this. Okay. Okay. Yes. Hello and welcome to Seven Sentinels. This is GrandMasterClass and I'm Peter Simon with you. Today we are conducting a reading session. Test 1 Part A, Pneumonia. Episode 1, Trainer Series. Multiple choice questions. Now we are moving to the first. Now this is the second slide. text B. Now we have text C. Yes, now text D. So that is the four texts. Now these are the questions. Go through the questions carefully. Yeah. So now we are moving again to the text A. We are moving to text A. Now let us see here, question by question. We are going to do lot of tests. Now first, what is the step that you have to do here? What is the first step that you have to do? So the first step that you have to do is you should understand what the title is. The title is a pneumonia. The title is pneumonia. So that's very clear. So what we'll do is we'll apply the title here, pneumonia. This is pneumonia. Fine. That is the title. And we'll get yeah. Can you hear me now? Can you hear me now? Can you hear me now? Hello? Yeah, now you can hear. Okay. Yeah. Yes, fine. Right. You can hear now. That's good. Now let us check. Now can you hear me? Can you hear me now? Now? Now also you can hear me. Okay, that's good. That's good. Yeah. So Shams. Hello, Shams. Hello, Shams.
Yeah, now it's
Hello.
fine. Now it's
Yeah,
fine. I
you
was
can hear
mute.
now, right?
Yeah,
Yeah,
yeah, now
that's
it's
fine.
fine.
That's fine. Okay.
Mm.
Right. It's good. Right. So we are going to see these four texts A, B, C, D. One of them we'll check. Yeah. So now let us see this one. So now first see, pneumonia is the title. Pneumonia is the title. Okay. Pneumonia is the title. Now let us see what subtitles are there here. What are the subtitles here? Let us observe. The first one, this is asking about, okay. Now let us see this one. What subtitle can we give this one? The subtitle is already there. Assessment, admission, and discharge. This is too much, very big. We want some subtitle, which is one word subtitle. Okay. One word subtitle. So it's already there. Assessment, admission, and discharge. So assessment in the beginning, admission in the middle, after that one, and discharge after the treatment. Okay. So three are there. We want only one. Okay. So next, in the same way, you think about that one and be ready. So second one. Now second one is here. The subtitle is already given here. Information to give patients community acquired pneumonia. So information to give patients. Very big subtitle. Very big subtitle. Okay. Community acquired pneumonia. We need a small title. This much big title we cannot recall. So what you can do is you can create your own single word title. Then next, text C. Text C, you have thoracentesis procedure. The title, subtitle is thoracentesis procedure. Two words are there. We should make this one also one. Okay. Next one, fourth one. Fourth one, text D. Now text D, it's telling complications. comments and treatment. So complications of pneumonia. We can say complications of pneumonia. Now, so here that's very clear. 4 things are there. So major complications of pneumonia, you can say, or some other thing. So we'll see 4 texts, A, B, C, and D. We'll have 4 texts, A, B, C, and D. Okay, now let us go again to text A. Now you can mention what type of suggestions can you give here? Give me your suggestions. What do you think? What do you think will be the title for this one? So give one word title, only one word. Only one word. Assessment, admission, and discharge. Information to give patients, community, and acquire pneumonia. Thoracentis procedure. Communication, complications of pneumonia. There are 4 big titles. Now we want, okay, small one word sentences. Okay, one word sentence, one word titles. Can you give one word title for this one? What title can you give? Assessment. Okay, assessment is the title. First you assess, then if he is problem, if he has a problem, then you will admit. Then afterwards again you assess. If he doesn't have any problem, you will discharge. So altogether everywhere it is assessment only. So before admission, assessment. Before discharge also assessment. So assessment will be there from the beginning till the end. So we can give this one title as assessment. We can give this title as assessment. So let us take this word as assessment. Yeah. We'll take this one as assessment. Right. Fine. Next one, we'll go to B. Now, what title, what subtitle can you give for this one? What subtitle can you give for this one? So, information to give patients, community acquired pneumonia. So, this is information that you are giving. This is the information that patients are getting. This is the information about pneumonia. This is the information regarding community acquired pneumonia. So everything is related to information. So let us give this title as information. Information. Next. Text C. Now what subtitle can you give for this one? Thoracentesis procedure. Thoracentesis procedure. What subtitle can you give this one? So you can talk about this is thoracentesis procedure. So procedure we can give one word. Procedure. What we can give? Procedure. Procedure. Okay. Next, let us go to the 4th one. Yeah, this is about complications of pneumonia. So complications. So it so 1, 2, 3, 4, 5, 6 complications are there. 6 complications are there. So now let us see that one. So 6 complications are there. Right. Complications. We can give the title complications. Right. Complications. Okay. So we have got these titles. Okay. So we have got 4 titles. A is assessment, B is information, C is procedure, D complications. Now, this is the way how you have to identify. Okay. Right. Dr. Shams. Dr. Shams, can you unmute?
Yes. Yeah.
Is
Yeah.
my
Yeah.
voice
Yeah.
breaking or continuously there?
Sorry.
In between, was there any break in my voice or continue? No problem with audio.
Okay. No problem.
No, it's regularly clear, na? Or in
Yeah,
between,
no,
was there any situation that it was not clear?
no, it's fine.
It's fine. Okay, okay, fine. Okay, you can mute back. Right. Now coming to the point. Now let us see question after question. Question after question. Now let us see the first question. Now the first question, the typical recovery of timeline for pneumonia. Timeline for pneumonia. Recovery. Timeline for pneumonia. So what is the most important word in this? Okay, so we have 7 questions. Now let us read these 7 questions. The first question finished. Then second question, the definitions of medical terms. The definition of medical terms related to pneumonia. Okay, related
Mm.
to pneumonia. Then next one, the equipment required to carry out a specific procedure.
Mm-hmm.
The equipment required to carry out a specific procedure. Next, fourth one, patient guidance regarding medication side effects. Patient guidance regarding medication side effects. Next, fourth one, how to decide whether a patient should be hospitalized. How to decide whether a patient should be hospitalized. Next, sixth one, the underlying cause of some conditions associated with pneumonia. Next, the type of patient for whom the standard evaluation will need adapting. So these are the words here. Right. Now, you see there. Now let us go to the first question. Now let us go to the first question. We are going to analyze. Now, first thing is, what are the key words in the question? What are the key words in the first question? Now let us see. The typical recovery timeline for pneumonia. Those are the keywords. Okay, that is the question. That is the question. Right. Now, yeah. So, the typical recovery timeline for pneumonia. The typical recovery timeline for pneumonia. Now, there are 3 words which are very, very important. The first one is typical recovery. Okay. The second one is timeline. The third one is pneumonia. Pneumonia is everywhere. Pneumonia is everywhere. So pneumonia is not important. So typical recovery and timeline. What is more prominent? The more prominent word is the timeline. This is the most prominent word you can say. Okay. Timeline. This is the most important word. Timeline. Now, so this is the called the operating word. Timeline is operating word. So it is telling you which text it is going. Okay. Which text it is going. It is giving some direction. It is giving. So 3 important words are there. Typical recovery 1, timeline 1, pneumonia 1. Pneumonia is least important because pneumonia is everywhere. So that is not important. Typical recovery. So the typically recovery timeline. So typical recovery timeline. So timeline of recovery. That's very important. You have to note that one. So timeline is important. Typically recovery for what? What? So timeline for typical recovery. Typical recovery for what? For time. So is the timeline which is giving there. Okay. So that is the main noun here. So timeline is the operating word. Operating word. Because it's point out to the direction. It points out to the direction. What direction? Yeah, can you hear me? Yeah, I'm explaining. That's why I muted. No problem. Can you hear me? I'm explaining. Continuously, I'm explaining. Okay. Are you able to hear me? Is that clear? Yes, then fine. Then fine. I'm going to explain everything. Afterwards, I'll unmute you people when I need. So I'm explaining, only I will be explaining so that I can go very fast. Right. Now, so timeline. Timeline is not related to assessment. Okay. Timeline is not related to procedure. Timeline is not related to complication. Like that you can think. Okay. Now you can think like that one. Now see here, timeline. Where will you get timeline here? Timeline is related to information. It is related to information given to patient. So first week, what will happen? Second week, what will happen? Third week, what will happen? Fourth week, what will happen? After 6 weeks, what will happen? Like that. This is called timeline. So where is the timeline? So you have to notice that timeline. So now timeline is pointing to, yeah, let us see here. This timeline is pointing to information, that is B. Timeline is pointing to information, that is B. So what will happen when? Okay, that's all information. Assessment. Doctor will do this assessment. Doctor will do this assessment. Remember that. Doctor is going to do this assessment. So this information you will find in B. You will find in B. So that is information. Then next one, procedure. Timeline, will it be found in procedure? Procedure is what you are going to do. Okay. Procedure, what you are going to do. That's not timeline. So complications, different type of problems. So that is not in timeline. So it is most likely to be in B, right? It is most likely to be in B. Now what we'll do is we'll go to B and confirm whether it is right or not. Now let us go to, yeah, yes, check timeline is there or not. Timeline, is it there or not? So 1 week, 4 weeks, 6 weeks, 3 months, 6 months. Okay. So this is related to the information which you are going to give the patients regarding community acquired pneumonia. What will happen now? What will happen after 1 week? What will happen 4 weeks? This is called timeline. Time is given here. You can see here weeks, months. Okay, 6 months. From now onwards, 1 week, 4 weeks, 6 weeks, 3 months. Okay, 6 months. This is all timeline. So now you can decide, yes, now this is B. So let us think that it is B. Yeah, right. We can place the answer here, B. Okay. Yeah. Let us keep this answer here as B in the center. Okay. Right. Okay. Right. We got the word B. Next. Now let's move on to the next question. Second question. Okay. Second question. The definitions of medical terms related to pneumonia. The definitions. Okay. Now you see, text B is titled information given to patients. You know, all those things is matching. So it is typical recovery time, gradually how it is reduced. So we understood that one. Now let us see the second question. The definitions of medical terms related to pneumonia. Now let us go there. So definitions is one important word. Medical terms is another important word, and pneumonia is another important word. But pneumonia is the common because everywhere pneumonia is there. You can see in everywhere pneumonia you will find. There is no question. Everything is related because the entire topic is pneumonia. The entire topic is pneumonia. So that's very clear. That's very, very clear. So Now let us see again here. Yes. Now here the most important word. What is the most important word here? So the most important word is definitions. Definitions. So definitions. Now that is the most important word. Okay, now let us take that is called the operating word. That is called the operating word. Next. So if that is the case, now where will you find this information? Definition. Definition means explanation of medical terms. Explanation of medical terms. So some medical terms. Why you want to give definitions of medical terms? Because they are not very ordinary one. If ordinary ones are there, they can be easily understood. They can be easily understood. Okay. They can be very easily understood. But what happens? They are not able to understand. That's why they are giving definitions. For example, if you say, this is a table, you can understand. If I say this is a table, you can understand it very easily. You don't need a definition for that. If I say computer, then you don't need a definition. If I say Skylab, then maybe you need a definition. What is Skylab? First time I'm hearing this one. I don't know. Can you define? So that means this is not an ordinary one. This is a special one. This is a complicated one. So that's how you feel that this is some complicated words are there. Complications, complicated situations are there. So what you are supposed to do, there you have to give definitions for complicated situations. So it is complication. You can say this is complication. Yeah, definitions. So only for complicated situations you define them. Otherwise, if they can understand, you don't need to define them, right? So you need to define things when there is some complication. Otherwise, you don't need to define them. Okay. You don't need to define them. Okay. Dr. Shams, I'm unmuting you. Whenever I ask or whenever you cannot hear, you can tell me that I'm not able to hear the audio or something. Or if I ask a question, then you can answer. Otherwise, keep it silent. Okay. Right. Now,
Okay.
next one. If there is a need, then you can. So, definitions. Definitions will be given. Definitions will be given when you cannot understand it. For example, um, bachelor's degree. Bachelor's degree. Anyone can understand. Okay. Bachelor's degree means anyone can understand. Aviation degree. Aviation degree. What is this aviation? So you need to give a definition. Aviation is related to flying. So this is regarding airplanes and that. So you have to give a definition because it's a complicated term. Everyone cannot understand. Then you have to give a definition. I hope you understand what I am telling here. So now text D is a table of complications. You know already. Complications like different labels are there. Okay. Now let us go there and check. Let us go there and check it out. Now, text D. Text D. You can see here, text D. Text D, lot of complications are there, and definition is also given just below that one. You can see here, bacteremia. First one is bacteremia. You can see here, bacteremia means the definition is given here. Presence of bacteria in the bloodstream. Presence of bacteria in the bloodstream or multiplication of bacteria in the bloodstream. So this is very clear here. This is very clear. So now, for example, ARDS, ARDS, acute respiratory distress syndrome. Acute respiratory distress syndrome. So here you see it very clearly. So now the definition is given. What is the definition? Buildup of a fluid in alveoli. That's the definition. Emphysema, empyema. So that is infection of the fluid. Pleurisy, inflammation of pleura. So these are the definitions of the terms. Term is given. It's a very complicated term. So explanation or definition is given. So lung abscess. So lung abscess is a complication. So definition is given. What is lung abscess? Abscess means what? We don't know. So they gave an definition. Formation of pus in a lung cavity. So this is how you, yeah, it is very clear. So complication, definitions of complications. Definitions are there in complications. Yes. These are the terms. 1, 2, 3, 4, 5, 6 terms. The fifth term is pleurisy, and definition is inflammation of pleura. So like that, you will get the definition. You will get the definition. So next, let us label it D. Yeah. So here it is D. Yeah. That is D. Yes. Now next one, third question. Now let us take the third question. Right. So that's very clear. Question number 3. The equipment the, the equipment yeah. So the equipment required to carry out a specific procedure. Okay. The equipment required to carry out a specific procedure. Okay. The equipment required to carry out a specific procedure. So, can you hear me, Shams?
Yes.
Yeah. So the equipment required to carry out a specific procedure. Right. Now let us see this one particularly here. So the words which are important, equipment and procedure. Equipment and procedure. These are the two words which are very, very important. The equipment required to carry out a specific procedure. So you can see now the word which you have to take is equipment and procedure. The word procedure is more important. The word procedure is more important than equipment, because if procedure is there, then only equipment. If equipment is there, no, what procedure you need to know, so that you take the equipment. So procedure is more important than the equipment. So equipment, you cannot take any equipment to carry any procedure. No, you should know what procedure, then only you will take that equipment. So procedure is more important than equipment. So this is related to what type of procedure? Specific procedure. Specific procedure is what? The name is already given, thoracentesis procedure. So it is related to C. It is related to C. So procedure, it is specific procedure, thoracentesis procedure. You have to remember that. Thoracentesis procedure. Next. Let us now go and check that one. Let us go and check that one. So equipment required to carry out a specific procedure. We'll go to C now. Yes. Thoracentesis involves the removal of fluid from the pleural space. It involves the following steps. So the equipment. What is the equipment? Now there may be an equipment somewhere written in between. So you have to identify that. Okay. It will be there. Yes. So catheter. Okay. You can check like that one. So here intercostal vessel injury. So here you have 18 gauge over the needle catheter. Yeah. So 18 gauge over the needle catheter to the syringe. So yeah, something like this one. So what is the instrument? What is the equipment? You can identify. Now we can go to the question again. Yes. Now, so this is which one? C. The answer is C. The answer is C. So let's write C here. Yeah. So we have written C here. Right, that's very clear. Next one, we'll go to the question number 4. We'll go for the question number 4. Patient guidance regarding medication side effects. Medication side effects. Patient guidance regarding medication side effects. So now go to question number 4. Okay. Yeah. Question number 4. The keywords are patient guidance, medication, and side effects. So the three words that are there: patient guidance, number 1, medication, number 2, side effects, number 3. So guidance, the word guidance is more important here. Guidance, patient guidance means guidance for patients. So guidance, that means you are guiding the patients. So patient guidance, when you are guiding them, you are going to tell them something. Okay, you are going to tell them something regarding medication side effects. That means you are guiding them. That means you are providing information. That means you are providing information. You are providing information. That's very, very clear. You are guiding the patients. That means you are providing information to them. So guiding by providing information. So that's very clear. You are guiding the patients. That means you are providing information to the patients. So if you substitute those words, you are guiding means you are providing information to the patient regarding medication side effects. If you remove guidance and you say providing information. Okay, so like that one. So here we feel that the answer is B. Now what we'll do, let us go and check. Okay, in B, yes, guiding. So you are guiding the patient. You are guiding the patient regarding what? You are guiding the patient regarding what? Regarding what? You can see there. Okay, regarding medication side effects. What are the side effects? You can see there. Possible adverse reactions. You see here, possible adverse reactions in this. Provide patients, here bullet point number 1. Adverse reactions means side effects. Adverse, not positive, negative side effects. So reactions means side effects. Reactions means effects. Adverse means side effects. Okay, to antibiotics. Adverse reactions means side effects. Remember that. So that is correct. So answer is, you can go there and you can write here. What is the answer here? It is, we are deciding the answer is B. Afterwards, we'll check the answers, no problem. But the answer is B. Right. Next. Next, we'll go to the next question here. Okay, question number 5. Question number 5. Question number 5. Now, let us study this question number 5 here. How to decide whether a patient should be hospitalized. How to decide whether a patient should be hospitalized. How will you decide that he should be hospitalized? So you are going to evaluate him. You are going to check his signs and symptoms. You are going to analyze. You are going to investigate. You are going to examine the patient. So you have to understand that. So what is the word that is related here? What is the word that is related here? So decide, patient, hospitalize. Decide, patient, hospitalize. So when should we admit him to the hospital? When you cannot just say like that one. First you have to confirm some things. There are some basics which you have to follow before admission. If he is his condition warrants an admission, then only we'll give admission. Otherwise, we'll not give. So what are the conditions that require an admission? Whether you have to check and confirm. Oh, he has high fever. Yeah, high fever means he cannot manage at home. So he has to be admitted. Low fever, no need admission. So you are going to check him. You are going to test him. For example, you are going to check his temperature. You are going to check his all the different things. Then that is called assessment. Is this assessment now. Can we think about this? So what will we find? Hospitalized, assessment, or how to decide. So decision, you have to make a decision to go into hospital. So the decision will take only when you examine the patient. That means decide. So how to decide, the way to decide, the action you have to take to decide. To decide. Now what do you mean by to decide? To take some action, that means to assess. Yeah, to decide. If you assess, then you can decide. If you assess, then you can decide. If you examine, then you can decide. If you find the signs and symptoms, okay, check the signs and symptoms, you can decide. If you cannot assess, if you cannot evaluate or examine, you cannot admit the patient. So it's very clear, it's very, very clear that the answer will come from A. The answer must come from A. So that's it. Right? How to decide? By assessment. If you assess, you'll know what is wrong. If it is wrong really, then you will admit. If it is not that much serious, you will not admit him. That's very simple. Okay. Now let us go and check whether it is there in A or not. Okay. So only after confirming, you have to write here. Remember that. So A. Yeah. Now check that one there. Okay. Admission guide, low risk, home care. No need to admit. Moderate risk, admission. Okay. Moderate risk, admission. Okay. Normal admission. 3 to 5 points, high risk. 3 to 5 points, high risk, urgent admission or ICU care. So now try to understand this. So when will you admit the patient? If he is 1 point, no admission. 2 points, yeah, you can admit him normal. Okay, management. 3 to 5, high risk. So urgent admission without any delay. So you have to put him in ICU. So that's confirmed from here. Admission guide. Here, admission guide. So that's very clear that it is from A. Yes. Now we will write the letter A here. Fine. Next, sixth one. The underlying cause of some conditions associated with pneumonia. What are the causes behind some conditions associated with pneumonia? Okay. What are the underlying causes that, okay, associated, some conditions associated with the pneumonia? So go through that one. Underlying causes, number 1. Conditions, number 2. Associated with pneumonia, number 3. So these are the 3 important things. So causes. So most important thing is pneumonia is common. Conditions associated with pneumonia, okay, that is related to pneumonia. Cause, what is the reason? Okay. So normally you are going to study this underlying the causes of some conditions of associated with pneumonia, not normal pneumonia, some other causes associated with pneumonia. So where it will be, this is not just normal pneumonia, these are conditions associated with pneumonia, some other side effects, some other serious problems. Okay, it's not just pneumonia, is something more serious than, so conditions associated with pneumonia. If pneumonia is there, some other conditions are there. So it's not just pneumonia, it is in addition to pneumonia something else. So something more, some conditions associated means more, added to. Associated means added to. So pneumonia plus, it's not just pneumonia, it is pneumonia plus. So assessment of pneumonia, first one. Information related to pneumonia, second one. Procedure, thoracentesis procedure, third one. Complications mean some additional problems. So this might be D. This might be D. So let us see that. So let us think that this is a D. Okay. Now, complications, causes, complicate causes. that are giving additional problems. That's the point. What are the, yeah. So some causes, the underlying cause of some conditions associated with pneumonia. What are the conditions? What are the background conditions? These are some complications arising. So let us go to D and check it. Yeah. Now you can see there. You have bacteremia. Bacteria means bacteremia is so associated with, these are all complications related to pneumonia. So bacteremia, presence of bacteria in the bloodstream. Okay, presence of bacteria in the blood. So this is a condition. Okay, this is a condition. Try to understand here. So this is a special condition where bacteria is present and bacteria is multiplying in the bloodstream. So this is a complicated condition. The cause is bacteria. Bacteria is the cause, and presence of bacteria is the cause. So that is why there is complication associated, okay, with pneumonia, associated condition with pneumonia. So remember that. So it is D. The next one, let us take pleural effusion. Pleural effusion, accumulation of fluid in pleura. So this is another condition. So fluid in pleura, fluid is accumulated. It should not be accumulated, but it is accumulated. So in pleura, there should not be fluid, but this fluid is getting accumulated in that pleura. So that is the condition. So that is pleural effusion. The next one, empyema. Empyema what? In the fluid, there is some infection. There is fluid, but the fluid should be there in this particular place, wherever it is. Okay. So in the fluid, infection is there. Okay, accumulation of fluid means increasing in quantity. So fluid can be there, but increasing in quantity. That's the point there. So the third one is emphysema. Emphysema means fluid, normally it is there, but infection is there in the fluid. There is some sort of infection. Okay, so that is another associated condition. So we have discussed 3 associated conditions. And D, suppose lung abscess, formation of pus in a lung cavity. So in the lung cavity, there is pus. So that is found there. So this is another condition, pus, the condition where pus is there. Pus is formed in the lung cavity. So all these are pointing out the conditions which are associated with pneumonia. Now, so what we think here, the answer is 6th question. The answer is D. Okay, let us hope so. All these answers are right or wrong. We'll check afterwards. Yes, we are going through. Next one, 7th question. 7th question, the type of patient for whom the standard evaluation will need adaptation. The type of patient for whom standard evaluation will need adapting means adaptation, evaluation. So now what are the words which are very important here? The words which are very important are type of patient, number 1, standard evaluation, number 2, adapting, number 3. So the most important word is adapting. Okay, but more than that one, the easiest word is evaluation. Now, the most easy word which can help us is evaluation. Now, evaluation means assessment. Evaluation means assessment. Now, if evaluation is assessment, that means the answer will be in text A. The answer will be in text A. So let us go to text A and check and confirm whether it is right or wrong. So type of patient for whom the standard evaluation will need adapting. Go there and check for adapting, adaptation or adapting. So, right. Standard evaluation will be adapting. Okay, now check there. Is it there? Check it out. Last one. I'm leaving it to you. Yeah, check there. If the patient has a dementia diagnosis, last bullet point. If a patient, last bullet point here, right side, bottom. If a patient has a dementia diagnosis, the mental assessment must be adapted accordingly. Adapted. Okay, a type of patient. Okay, so you see there, a patient has dementia diagnosis, the mental assessment must be adapted accordingly. That's the point there. So adapted accordingly. So adaptation. Now let us go to the last one. The type of patient. What is the type of patient here? A dementia patient. Patient is dementia patient for whom the standard evaluation, it should be adapting. So now the answer is A. So this is how you'll get the answers. So I hope you understand these points. Now we have to go and check whether these answers are right or wrong. So now all of you, I'm unmuting everyone. Okay. If you have any chance, you can unmute and you can speak. Do you have one by one? I will ask. Yes, Dorcas. 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 Yeah. Do you have any doubts? Regina. Those who have doubts, you can unmute and you can speak. Shams. Any doubts or confusion or questions?
No, it was very nice explanation.
Okay. You got everything clear. Okay, fine.
Yeah.
So now we'll go and check the answers. Now we'll go and check the answers. Now these are the answers. Let us see the answers here. Okay. Let us see the answers. Now, so yeah.
All the letters here as well again. B,
First
B,
one is B.
B. Yeah, B.
First one is B. Okay. So first one is B. This is right. Second one is a D. So D is right. Third one is C. So C is right. Fourth one is B. B is right. Fifth one. Fifth one is A. A is right. Sixth one is D. D is right. Seventh one is A. A is right. So we have got all correct answers. We have got all correct answers. Now, one by one, you can give your feedback. What did you learn and how beneficial it was? Yeah, first let us start with the Shams. Your mic is already open, so you can give your feedback, please.
Yeah, I told you before it was good explanation. Which word like timeline is related to information, and there are you explain many synonym word as well. Uh, yeah, it was very nice. You explain.
Okay, right. So that's good. Next, Dorcas. Dorcas, what happened? You're busy, huh? Okay, Regina.
Both
Yeah,
of them is mute.
yeah,
Yeah,
Mhm.
Regina.
yes. Thank you so much. The strategies were so they were on point and they were very simplified. So I think that when we're able to apply such strategies during the exams, it will really simplify the whole thing for me. I am really impressed. Thank you.
Yeah, welcome. So we are going to have the second session. This is episode 1. Episode 1 is multiple choice questions. Then we'll have episode 2. Then we'll have episode 3. So we
Mm.
have 3 episodes for part A. We are going to start episode 2 shortly. We'll continue this one. Okay. If you have, okay. So clear all drawings. Yeah. So these are the answers. So, and there are the points where it is the explanation which I have given you. You can see there, the answers are here. Then next one. So this is for the online viewers. You can all check your answers. Those are watching online, YouTube, or Facebook or anywhere, those who are watching this video, then you can just go through, check your answers and give your feedback. Okay, so it's very important. And all of you, those who want to watch the next episode, it will be started within. I'm not going to close the window. Okay, it will be there immediately. I'll start, so you can come and join, because within 10 minutes I'm going to start the next session. If you want, in between you want to do something, have a cup of tea or something like that, you can get them. Okay, so I'm going to 20 seconds more. You can, so you can analyze these answers also. Why it is that one? All these things you can notice here. So 1 to 7 questions we have finished so far. So how many marks you might have got? So you can just respond, and how beneficial it is, you can explain. So my dear friends who are watching on YouTube, if you want to attend the sessions regularly, you can subscribe to our channel, and you can like the video, share the video with your friends, and comment below how beneficial it was, so that your support, your feedback, your suggestions will be much more beneficial, because that will make us, that will give us motivation to go ahead and do more such videos. So please do these 4 actions without fail and support our work, because little goes a long way. Share the video generously. Provide your valuable feedback in the comment section. And if anybody is interested to attend sessions regularly, you can come and you can join my class and you can attend. If you want personal training sessions, you can register, because personal training sessions, you'll get personal doubts clarified, and individual sessions, and you'll get the writing corrections, and you'll get speaking sessions. A lot of things are there in personal. So if you want, you can register. Okay, right. Thank you for watching this video. See you again in our next video.